right, so our informal debate is going to discuss person first language versus identity first language. And my name is Ana Lopez.
I'm Cameron Constant.
I'm Bridget Goodrich.
And I'm Leslie Johnson.
So, an introduction. So basically, the language used to characterize disabilities as it relates to the individual has been a topic of discussion across the scientific community. There's a rise in research suggesting that members of the autism community have advocated for the use of identity first language, IFL, such as the term autistic, as opposed to person first language, PFL, such as the terms person with autism. So individuals advocating for identity first language believe that its use is not offensive, but rather increases feelings of autonomy and emphasizes autism as an inseparable identity from the self. And those who use person first language believe that doing so separates the individual from their diagnosis or impairments, putting emphasis on the person. And some factors we kind of gathered from our research that we find influence the language preferences are age, gender, relationship to autism, understanding of autism, social stigma, setting events, and cultural preferences. Next.
All right, so we'll go over person first language. In this section, we'll be talking about Tavois et al. Study, Dunn and Andrews study, and Bozeman and T's study. Tavois is pertaining to the reason person first language is used. Dunn and Andrews study goes to talk about the professionals utilizing person first language, and Bozeman and T's study is referencing a Dutch autism community and how there's a stronger preference for person first language. Next. So there's a psychological approach to person first language that shows that when placing the disability before the person, the identity first language, which is the identity first language, dehumanizes a person and limits their ability as people see the disability instead of their abilities. And that goes along with Dunn and Andrews study in 2015, where the abilities and the individualization of everyone is ignored, and their disability is the main focus in identity first language, limiting a person using words such as segregation, like race or ethnicity and religion. It's the same thing. Person first promotes identity first promotes stereotyping and ignores the differences, but people with the same diagnosis have different challenges, and identity first is grouping everyone together regardless of their differences. Tavois et al. Is talking about person first language that counteracts negative attitudes towards people with disability, which also goes along with Dunn and Andrews study in 2015. Person first promotes individuality, such as their strengths, challenges, and experiences. Person first language originates from the people first advocacy group, which showed great disapproval for the dehumanization of humans because of their disabilities, like the identity first language. The person first language decreases stereotyping and focuses on the person and their abilities, while identity first language places the disability first and ignores and blocks the individualistic characters that give a person the ability to participate. The person first language was adopted as the appropriate term for medical professionals and is now used by medical professionals to emphasize a person's ability instead of their disabilities. Bozeman and Teese, their study was in 2004 or 2024, I'm sorry, and it conducted a survey that was put out for 313 individuals, but only 215 individuals completed the survey. It focused on the perceived consequences of person first language and in identity first language. It used two sentences for the perceived consequences, and it was, and I quote, I think that person first language or identity first language contributes to a decrease of prejudice about people in the autism community. Or it would say, I think that person first language and identity first language does justice to the identity of people in the autism community. And this was rated on a 1 to 7 scale, Blackard scale, with 1 being strongly disagree and 7 being strongly agreed. Then the other part of it goes into the evaluation of person first language and identity first language, which was self-directed and others directed. And there were multiple statements that were similar to, how would you generally feel when someone talks to you or about others in the autism community in person first language or identity first language? And that was also rated on a Likert scale of 7, with 1 being really undesirable and 7 being really desirable. We can go to the next one. And this goes back to the Duns and Andrews and Tabos study, where the professionals, you can see with the light gray that the professionals and family and friends highly recommend using person first language, which is about the same as the parents' view on identity first. So it's almost like it's equal. We can go to the next one. And this goes back to Bozeman and T's study, where it shows the perceived consequences between person first language and identity first language. And you can see that the identity first language is about a little higher, but they're kind of equal in agreement to which would be better. And then the evaluation that was self-directed and others directed, you can see that there's a difference where person first language is the most preferred or desirable statement rather than identity first language. We can go to the next one.
All right, thank you, Leslie. I'm going to go ahead and switch over to identity first language. So in this section, we found many studies that those within the autism community typically prefer identity first language for several reasons. The first of these reasons being that using identity first language over person first reduces some stigmas and stereotypes by avoiding the unconventional language that most people are not familiar with. Using this type of language tends to draw more attention to the disability. An example of this would be if one were to say person with autism versus an autistic person. Another reason those within this community tend to prefer identity first language over person first is because person first language seems to separate the individual and their disability. Some studies have shown that those in the community actually prefer to include their disability as part of their entire identity. My final point for identity first language somewhat ties into the second point. As stated in both those articles, identity first language was previously used to dehumanize those with an autism diagnosis. However, by giving the person the right to choose how they would like to be addressed gives them some empowerment back through self-determination. And then some findings that show preference for identity first language. In this section, there were several studies that have shown a strong preference for identity first language in those either diagnosed with ASD or care closely for somebody with the diagnosis. The first study I thought to address was Tabois's study that included 728 individuals in the autism community. This meaning they were either diagnosed with autism or care closely for someone who has been. And of this group, minus a few participants who were unable to complete the study for various reasons, 87% of them showed a preference to identity first language. Another study we found regarding a preference to identity first language was one on people who speak the French language. This contained 541 participants, and these were all adults who had a diagnosis of autism. And this study revealed a 72% preference to the identity first language.
All right. Here I have a table from one of the articles discussed previously from Ujisman and colleagues in 2022. And this one demonstrates the terminology preferences in adults with autism. And the table breaks down the predicting traits such as age, intellectual ability, gender, education level, and some others. It was found that younger adults with many autistic traits and a higher IQ were relatively more likely to prefer IFL language compared to PFL language. Adults with higher IQ and autism traits were more likely to choose IFL. There was no significant correlations relating to gender in its predictor of IFL or PFL preference. And overall, the authors deduced that younger age, more autistic traits, and a higher intellectual ability were identified as predictors of preference for IFL compared to PFL in autistic adults. Next.
Okay, so this is a bar graph depicting the results of the French study that Cameron was talking about. So this was another forced choice task language preference survey with 541 French participants who all had an ASD diagnosis. So the first one that most participants ranked as their first choice to be referred to, 397 of participants ranked the French version of autistic person as their #1 descriptive term. The next one is the French term for autistic. 370 participants ranked this as their #1 preferred descriptive term. The third one is the French term for neurodivergent person. 250 out of 541 participants ranked this as their preferred descriptive term. The next one is the French term for person on the autism spectrum. 150 participants ranked this as their preferred descriptor. The next one is person with autism. 140 participants ranked this as their preferred descriptor. And then the last one, this is a shortened name. It's ASPE for Asperger's. About 130 participants rated this as their #1 preferred descriptive term. So the top 3 preferred terms were all identity first language. The results of this study showed.
Bridget, do you mind going back one slide before the one you just previously did?
Yeah.
All right, so this figure is from Tabois's 2022. It kind of describes the terms chosen by autistic adults on a forced choice task in a language preference survey. And as you can see, the first 2 terms took up 77.2% of the participant terms for preference. And both of these terms were IFL terms, such as I am autistic and I have autism. And that, yeah, given that this was a forced choice task, it didn't really allow room for participants to choose a variety of these terms. So based on the results, they found that most individuals preferred an IFL term as opposed to a PFL term. And yeah, and then you can go to the next slide.
And then just to clarify before we do the remaining questions, when Anna was talking about the IQ correlation, I had the wrong slide up. So this is the figure for the IQ correlation, I believe, with the PFL and IFL. I think I had this one showing before. So I just wanted to clarify that before we move on to the remaining questions.
Oh, gotcha. All right, who wants to begin with the questions? Or Leslie,
can.
do you want to read them out? Okay.
Yeah. So the first question is identity first language a means to marginalize humans or empowerment of positive social identity?
I think they're doing research for this debate. The group came to a consensus that it's a common conception amongst the professionals and stakeholders working with these individuals that may have a diagnosis, that it could be marginalizing to them to use IFL, but the research actually shows that these individuals actually see it almost as a way of empowerment, and they don't want to be separated from their diagnosis. They view it as a part of them and they embrace it. So they actually prefer to use IFL.
I agree.
Yeah,
I was
definitely.
actually looking at, sorry to interrupt. I was looking at back to the Dutch article we had referenced earlier, and when they were kind of discussing the two different viewpoints from PFL and IFL, one of the things they mentioned was that IFL supporters claim that separating the disability from the individual might actually increase stigmatization. I'm gonna say that stigmatization, because doing so is like unintentionally strengthening its negative connotations. So I think it also has to do with like a shift in societal view, kind of in terms of we have always used, or we have commonly used, the medical term favoring person first language to kind of show that we are trying to destigmatize these disabilities, but in doing so it kind of unintentionally brings more like negative connotation to it's doing. I don't know if that makes any sense, but I thought that was really interesting to see how us, or how individuals, in trying to actually reduce its stigma, can actually be perceived as like an increase in stigma from using PFL language.
That actually brings us to our second one, which is utilizing person first language a way of separating a person from their diagnosis as if it was a negative trait, like stigmatizing a group. And I have to agree, it does make it seem more of a
Yeah, definitely.
And I think it also has to do too with like if we look at disability in a very broad term, I think with autism, because it has a lot of, it's very socially mediated in the field of ABA, like how we kind of refer to a lot of these terms, whereas in the medical field, I feel like disability is very more like scientific. Like for example, you wouldn't refer to someone with Ehlers-Danlos syndrome as like, oh, they are EDS. You would more likely refer to them like in person first language as like, oh, they are a person with EDS because they have this disability. Whereas I feel like autism being more of a like neurodivergent term, that is more so like, I feel like it affects an individual and their, I guess, their being more so than a like fully physical disability would in that sense. So I guess it also depends on like what the disability is. And I think since um the field of ABA is kind of trying to like slowly shift away from using solely just like medical terminology, I think we may see some differences in like future research um, with, I guess, more social validity coming in to these discussions.
All right, and the third one, in order to be ethical and supportive of clients, how would you address this topic with a client? Obviously, if they can make these choices, and would you allow them to decide, or would you decide for them in terms of person first language or identity first language?
I would refrain from ever trying to decide for them. I guess even if my client wasn't capable of choosing, I would then go to a stakeholder or somebody closer to them. I would never leave it for me to decide. Um, but yeah, I would definitely try and address this with any clients that were of age and capable of deciding for themselves.
Yes, I agree with that. It's definitely their choice and how they want to be labeled. And if they can't, then it's best what's best for the family.
Right, definitely. And I would try and communicate this with the family as early as possible, try and prevent any confusion or conflict, later down the road, just have it up front.
Exactly. And then our fourth one are our personal views of person first language or identity first language setting a negative view on diagnosis.
So I know I can speak from a personal viewpoint. My bachelor's degree is in education, and in my education classes, we were really, they really pushed person first language. So I naturally have like not a negative view on the diagnosis itself, but a negative view on using identity first language, because again, it was drilled into our heads that it's rude, it's not the nicest sounding, and we should really focus on the person, not the diagnosis. So this project doing research on person first versus identity first was really eye-opening in that aspect, and kind of had me look at my own biases and maybe negative views that I might have already had.
Yeah, I agree. On person first language definitely was more taught to us in school, I believe, which was definitely conflicting with a lot of the research we found, because obviously most of it swayed more on identity first, but I felt the same way and thought it was a little strange, putting the identity before the person.
I think too, and this is, I guess, talking from another like personal perspective, but with individuals that I have met that have been in their teens or their late teens, early adulthood, they have also, since they were diagnosed with autism, they have also preferred to use the identity first language. So I think it's kind of coming back to the research where I think something that Leslie mentioned earlier, where the stakeholders and the caregivers were more likely to use person first language. It may also just be a generational thing. I think like in the upcoming years, there may be a shift in language just because I think research has focused a lot on the perspectives more so now in recent research on like the perspectives of individuals with autism as opposed to just heavily relying on empirical and like scientific data that is more so contrived. But I think more so of the viewpoints now, even from looking at websites that have autism voices and stuff like that from the individuals, they have, a lot of them do prefer to use identity first language. And I think it may just be the difference of us not necessarily like identifying with that diagnosis. That may be like one of the biggest factors. I feel like all of us may feel like differently. Obviously, if we were diagnosed with autism, we may completely view this differently. But I think us as being in the viewpoint of caregivers and providers, I think we have always been, you know, kind of like how Bridget was saying, kind of just drilled to use person first language from the medical term. And I think that that may change in the future. But again, it really just depends on the stakeholder and like kind of who you're working with and the population. With us working with most, or I can assume most of us working with younger kiddos, we're mainly just communicating these issues, if at all, with the parents and stakeholders. So I feel like if we had to decide on the spot, it would probably be more appropriate to use person first language. But again, this can be something that can be discussed firsthand with the family. I don't know how this would come about. Maybe there will be more research in the future of like how to bring this up during the intake process or during parent guidance meetings and all of that. But it may just be an issue that may be like kind of similar to how gender is viewed recently. Like, oh, you may just be a more casual scenario where you are just meeting the family and then straight up asking them like, oh, like what language do you prefer? As opposed to making it, you know, like a bigger deal. But yeah, I really don't think coming back to the question, I don't think that these views set necessarily a negative view on the diagnosis. I think it really just depends on who you're talking to and their relationship with autism. And I don't really think there is a way to kind of like avoid making a mistake, so to say, with any person. It might just be like something that you have to push through. And again, trying to be as understanding as possible with who you're speaking with. If you're speaking with a family, like I guess as future analysts, this will just be have to be something that we keep in mind before we use the language that is more comfortable for us. Kind of like how we in society have had to like shift our views and like adapt to meeting different individuals who may identify with different genders or different, you know, cultural groups and everything. So I think it may just be the same as like those different scenarios where we just have to kind of be careful with what we're saying and like to whom we're speaking with, and kind of just identify like what you would think in that instance would be the most appropriate for that person.
Yeah, I also really liked the bit that you talked about where you say that the language might shift later on also, because as we've been studying, the ABA field is very new, and most of the stuff that we're either doing on the floor or like, you know, practicing in every day is stuff that is either started with ABA from the very beginning or just somewhere down the line has been proposed. So everything is constantly shifting and changing. And, you know, we can pick a side here today, and 5 days, 5 weeks, or 5 months, you know, there's going to be more research that comes out that will totally flip it on the other side too. So I feel like just because of how new and ever changing it is, you know, it definitely makes it a little more complicated to try and stick your feet in the mud on one stance.
I agree.
Just to piggyback off of how the language seems to be always evolving and changing and what the correct answer is. I didn't add this as a question just because there's not enough research, at least that I've found on it. But I think with social media and technology becoming more and more prevalent in society, you know, on TikTok, you can see a person talking about their diagnosis and how it's affected their socialization and maybe personal dating life. And they will open it with saying, I am autistic. And they will, you know, use that identity first language and call themselves autistic. So I think that that, like the rise of social media, could be correlated as well with the destigmatization of that identity first language. So I definitely think in order to be ethical and supportive of our clients, obviously they should have the autonomy to choose how they'd like to be referred to, but also we should keep up with the, I don't want to say trends, but keep up with what seems to be the most common language preference, because I do think it's changing. And with social media, like I was talking about, I think that could be some of the reason for the disconnect with what we've been taught and what the results are saying, like almost like a generational gap from like the participants in the research and then like the stakeholders, if that makes sense. So I think it's interesting.
Definitely.
There's definitely, there's a little bit of research on this, person first language and identity first language, but more needs to be done. And as more comes out, it'll become more modern and up to date with what is going on in society.
Yeah. And even like as we were looking at our research, like we even had kind of a hard time looking for like a lot of sources that are recent, at least. A lot of them were either very broad in terms of the term disability and kind of more so like pushed towards the medical model, whereas like finding resources that were specifically focused on autism were kind of scarce. There was only like the ones that we mentioned in our article here. Um, so I think that with time, hopefully, there will be more research out there for sure. All right, and then I guess we can put in one more question. I had one question I kind of wanted to add. Has any of the research we've done swayed your viewpoint on which language you will use in your day-to-day life?
I believe I would probably stick to what has been ingrained in me, kind of like what Bridget was saying with person first, until or if I ever had a clear and definite preference from the client themselves. For whatever reason, it does still seem a little stigmatized, maybe, or just the way I've been taught. So I think I'll probably stick to what I know until I've been told otherwise.
I agree to piggyback off of Cameron. I work with younger students, many of whom are non-speaking. So I will probably stick with person first just because I'm mainly interacting with stakeholders. 9 times out of 10, the parents. And again, that generational gap that I was talking about, they do seem to react better to child with autism than you have an autistic child. So just from my experience and my like personal biases, what I've been taught, I will probably be sticking with person first. But of course, if I were to have a client that could verbalize or communicate what they would prefer to be referred to, I would obviously follow their preferences. I do think it's interesting that most people that were able to communicate their diagnosis chose IFL. So maybe if I ever end up working with older clients or students that can communicate what they'd like, I'll default to IFL instead of PFL.
Yeah. And I think it's also important to mention all of our research focused on things like data from adults. So I think it would be really interesting to see viewpoints from children. And I guess a lot of it does have to do with different like ethical concerns with, children putting in their like preferences without really knowing much about the situation, not knowing much, but like not being as informed as an adult would be on the matter. But I think it would be interesting to see how not necessarily young children, but maybe like early preteens or teenagers would react to these sort of questions that were introduced in these surveys and things that we found. And again, how you were saying, yeah, we are really mainly in this field since we're all kind of working with early intervention. It is more so that we are all working with super young kids, and this doesn't really apply to them. We're not really referring their disability or anything during our therapy in any way, really. So when we are discussing autism traits and all of that, we are really only communicating with the parents and stakeholders, which may also be like shifting the data from research a little bit, just because we are only really getting the viewpoint of stakeholders and, you know, caregivers when it comes to person first. And so I don't know, that may be different in the future, but I think if I were to be working with adults with autism, it would be very different. I would definitely probably use identity first, but because I am working with children, I think it's safer, like you said, to use person first.
Yeah. And then for me, it's like I kind of am on both sides of it. I am a stakeholder and I'm a professional. So I kind of flip-flop back and forth. Professionally, I use person first, but at home, I go back and forth. My daughter is a teenager and she says, I am autistic. So I see both sides of it and I kind of speak it fluently from both sides.
That's
I also
awesome.
think when making the decision, keep in mind especially with like those preteens, as humans, we're innately socializing with each other. So one reason they could be preferring the IFL is because they're aware that autism affects how they socialize. So they almost want that to be known so that the person they're interacting with kind of understands or is aware that how they socialize might be different. So we're again, PFL, they do it to try to destigmatize, but actually the people with autism use IFL when so that when they're socializing, people don't feel a stigma towards them when they might be socializing in like a non-traditional or odd way, and they know why things might be off when they're talking.
Mhm.
And I think there was one article that we actually used, I'm not sure which one, but one was mentioning how, let me see if I can find it in our outline, but it was mentioning how the age of their diagnosis affected their preference for IFL and PFL. And it was saying how those who were diagnosed later in age towards adulthood were more likely to use IFL.
Mhm.
And I think that was really interesting. And also, like how you were saying with the social aspect of it, I think that if someone is confident and like feels secure within themselves to identify as autistic, I feel like that's when obviously they would use IFL language. Whereas someone who may be newly diagnosed or still feels pressure from that stigma and everything may not feel as comfortable using IFL terms. So I guess it does kind of sway both ways depending on those social factors and how one identifies with the disability themselves.
So just to wrap things up, we wanted it to have a clear conclusion. We should be using PFL, we should be using IFL, but based on our research and just some personal experiences, we decided that the best conclusion was that there is no right or wrong answer, just due to some of the conflicting answers. If you're working with younger kids, you're communicating with stakeholders. Stakeholders have shown that they prefer PFL. But if you're working with older clients who can communicate and understand what this means, then they prefer IFL. So overall, for our conclusions, there appears to be no right or wrong language to use universally. Professionals will need to address client and stakeholder preferences before or during services to gauge which language to use in each scenario. Again, it's in the ethical code. We're always trying to promote autonomy. So the best way to go about this is communicating, asking them what they would like to be referred to as. And then finally, universities and educational facilities tend to use the medical model, which has favored person first language for disabilities. The field of ABA has been shifting towards the minority model, which is identity first language in their terminology. So future research may present better conclusions. And again, I think the whole group can agree, while we were researching on this project, we did see various like deficits in research. Again, those younger kids, we didn't see much research on that. It was all older adults that had more verbal skills. Another disconnect could be clinical versus school-based settings. You know, the generational gap with the rise of social media. So there's definitely a need for future research on this topic and what language we should be using.
Awesome. And then there's just our references. And that is it for our debate.
Thank you, everyone.